Hey, Dr. Lindsey and Wendy here. We're filming these right before Wendy takes another one of her mini sabbaticals so she can get some rest and relaxation and a nice tan. Today's case is a race car driver, right?
Yes.
And this guy came in and he's got fine hair. And look at him, he's bent over a little bit. He's bald all the way back. He's essentially a class 5, maybe even a 6 with still has a good tuft. And so we did a frontal U on him, which we got lots of videos to talk about what a frontal U is. And here he is packed in at the end of the case. Now, Wendy, you wanted to say something about packed
Well,
in.
yeah, you always say, well, you packed it really nice there. And, and there's people that could say, well, that doesn't look as packed. They can still see spaces. You can see some skin.
So what are the issues?
The issue is he has thin hair, right? So you have to kind of like just spread it out. As much as we want to dense pack it, we have to spread it a little bit to give him a good size.
And the roots aren't as skinny as those hairs, so the roots take up.
They take up much space, and you need that space for blood vessels to have.
Yeah, second is blood vessels. You gotta have some room for blood vessels and circulation.
We're in the second. The second is, you plump up those.
That's the third one. You plump up.
That's the third one.
The expansion of the scalp.
The scalp, yes.
So like if you take a balloon and you blow it up and you draw on it, and then you let some air of the balloon, the lines become much more crisp, right?
Yes.
Right.
And that's when patients say, my hairline is so high, they forget that they're very, very swollen.
Yep.
And then I said, don't criticize it. Wait for about 2 weeks.
Okay, so let's go on. So here he is at 1 month. And he's doing a good comb over, and he looks unremarkable, right? I mean, he was able to get back in his race car and wear his helmet at 10 days, and do his comb over, and nobody was the wiser.
No,
right?
He uses some topics. It looks.
But then when he bent over, and now he pulled that thing up, I mean, everything we put in fell out like it's supposed to. And he's got really white skin and fairly dark hair, and so you can really see that. But he's able to camouflage it just by doing a comb over, and then like all of our customers, they think in about 6 or 7 months it's done, and he rolled in last week at 8.5 months.
Yep.
Happy, but thinking that was all he's going to get, and he looks good. But he's only
he
going
looks
to get
good,
better.
but it's only, yes, it does. You definitely, there's plenty of videos where we show pictures that are 8 months, and then when they come in like 12 to 14 months, and it is a really nice difference.
And here's his scar. He got a good scar.
Yeah.
In spite of wearing a whatever kind of race car helmet that people wear.
Yeah.
And he did an autograph picture for us. It's hanging up in the office, and we'll get him back and do his crown after the whatever season.
He said, there's some South America something race or something. And then he said he'll do it afterwards.
Yeah, and hopefully he'll let us use his picture, but right now he's holding that off. Yeah. So if we can help you, please give us a call. Thanks.
Thanks.